AI analysts, bioinformaticists, but also in requiring existing roles. So requiring our nurses, requiring our respiratory therapists to learn new skills to work with AI systems and to interpret results. The second, which is I think going to be so impactful, improving patient care through deep learning and machine learning, such as reading pathology slides and then interpreting complex imaging data. The ability of AI to really transform the way MDs and diagnosticians think about disease is going to really be changed dramatically with AI. And the third one, which has big implications for community college workforce, is to enhance workforce training through simulations and virtual reality. And when you think about how we train nurses, respiratory therapists, paramedics on the community college campus, we have the ability to do simulations in VR. And that offers a student a no-risk environment to practice their skills and to really hone those clinical reasoning skills. So it's really changing the way we're training healthcare professionals. So our panelists today are going to explain more of these topics, and I'm going to introduce each of the panelists now and give them time to make a few comments before we move to the specific question and answer portion of the panel discussion. We have been asked to complete this by 11:50 today, so it's a little bit short, but please be thinking as we go along. If you have specific questions for the panelists as well, let's give them an opportunity to ask. So we're going to start. I'm going to start by introducing first Dr. Meredith Lee. And those of you who were in the panel discussion this morning heard her awesome colleague, Dr. Chase. But Dr. Lee is the head of strategic partnership and the chief technical advisor to the dean, Dr. Chase, at the UC Berkeley's new College of Computing, Data Science, and Society, the first new college on the campus in more than half a century. Her current portfolio focuses on identifying and enabling emerging opportunities in data science, human-centered design, and AI. With over 25 years of cross-sector experience, she's helped launch initiatives like UCSF, UC Berkeley, Joint Program in Computational Precision Health. And Dr. Lee's impactful career spans crucial leadership roles in the Obama administration, as well as in NSF Regional Data Innovation Hub. Her leadership extends to national and state boards, including California's Cradle to Career Data Science. Dr. Lee.
Thanks so much, Nanette. Good morning, everyone. It's so great to be here for the Future Summit, and special thanks to the Chancellor's Office and Foothill De Anza District for hosting. As Chancellor Christian mentioned just this morning, our new College of Computing, Data Science, and Society at UC Berkeley recently hosted a joint California Summit on generative AI with the Governor's Office, colleagues in Sacramento, and Stanford's Institute for Human-Centered AI. And one of the takeaways, one of the themes of that joint summit that has become increasingly evident is the need for cross-sector partnerships with industry, academia, civil society, including nonprofits, community-based organizations, philanthropy, and government at all levels. And if we think about the intersection of AI and the human workforce as applied to healthcare as a topic of this panel, but there's also climate, teaching and learning, arts and humanities, business. Nearly every sector, every touch point in our society has this window of opportunity to harness the power of AI to help benefit our communities and our society. Nanette asked me specifically about, well, what is so special about generative AI and AI as opposed to other technologies and emerging technologies? And so there are a couple of things just to frame some of our discussion. One is the scale, really the scale of the capabilities and how ubiquitous AI and Gen AI in particular, where you can create images, text passages, audio clips, video, and then very rapidly iterate and generate another video and another paragraph. That really over the past 20 or so months is quite remarkable if you step back even across all of technology. In addition to the scale and the ubiquitous nature, I think there's something to be said about the speed and the ease of use. If it took ChatGPT or other generative AI tools half an hour or even 15 minutes, everyone is so busy and they want everything so fast, right? So if it took 15 minutes to get back to you with something that was like, not so great, and let's say you had to explain what you wanted in Morse code, we would not be talking about this, right? It would just be a barrier to entry that is a non-starter for so many of our communities. And so when you combine that scale and the speed and ease of use, you all of a sudden start to have these open doors of possibility. And we heard some of them, and we heard some of the concerns on stage framing the summit this morning. Some things are really inspiring, aspirational. Does a unicorn and rainbows come with that? Because it really sounds like it's part of the package. Laugh line. Some things are, reducing drudgery, and some of us may want to reduce drudgery in our lives. Some things are raising and re-raising, reinvigorating serious questions about the underlying quality of data, the underlying quality of outputs, recommendations, things that are generated from our tools and platforms, and questions about how we as a community and society govern those technologies. And that includes what do we do with known issues and things that aren't known at the beginning but become a known issue and need to have a way to address it moving forward. At the end of the day, I think if we are looking to spark innovation and benefit to our communities and to our societies for the public good, there really isn't a single organization or type of organization or entity that has all of the key ingredients or the context needed to make a difference. And so this is really a team effort. So when we get to the Q&A portion, I really look forward to hearing from the expertise in the room of what you're hoping for at the intersection of AI and health and what might be possible tomorrow. And then per Chancellor Christian's charge, thinking in the future, what might be feasible long-term. Thanks.
Thank you, Meredith. And so now we're going to move to Dr. Howard L. Gans. Dr. Gans holds a PhD in molecular nutrition from Cornell and is a postdoctoral fellow with a very well-known lab at Stanford. She applies multi-omics to clinical mental health research, including depression, anxiety, and well-being, inspired by her own mental health journey. Her research is published in leading journals across mental health, nutritional biochemistry, and precision medicine. Dr. Gans is a founding partner at Arbin Ventures, supporting deep tech health startups. She co-founded the Stanford Mental Healthcare Innovation Summit and speaks at venues like CERN and the Precision Medicine World Conference, uniting experts for collaborative innovation. Arda.
Thank you. So nice to see you all today. I'm most excited about coming here to think about how AI can bring both medicine to be more preventative as well as Meredith was saying, bringing more speed to knowledge sharing and access. And coming from the lab environment that I've been in at Stanford, we have been measuring giant amounts of data repeatedly over time on healthy people and leveraging that data to make earlier detection of disease. And so specifically I've been working with Mike Snyder, who's been the chair of genetics, as well as the head of personalized medicine. And our lab does something that's called personalized longitudinal multi-omic profiling. So we measure millions of data points and use those insights to detect disease earlier. What's really interesting to me, coming from a background where my mother is a doctor and my grandmother was a doctor, and speaking to both of them, medicine was invented, or much of medicine came about before we had computers, before we had big data. My grandmother shared with me that she didn't learn a single day about DNA when she was in medical school, and yet she continued to practice for another 50 years after that. And while my mom was in medical school, she had to go to the library and look up every single thing she wanted to find. Now you can use Google, but as Meredith was saying, AI brings even a more accelerated version of that, where we have easy access to knowledge and people can share those ideas more rapidly around the world. One thing that is extraordinarily interesting to me around prevention, so when I first joined the lab that I'm in, my advisor Mike was the first person to use wearable devices like Fitbit and Apple Watch to detect disease. And my dad actually sent me a paper about this where he was able to identify viral infections days ahead of when the person could feel symptoms themselves. And we were then able to do that also for COVID-19, where 3 days on average before you feel sick, we can tell that you're sick from deviations in your heart rate. Interestingly though, when I first joined that lab, my mom as well as other doctors told me that these were junk data. Why would you take a not very accurate measure of heart rate and use that to make insights about health? And I think there's been a lot of conversation about what are important data points and what are unimportant data points for informing health and medicine and medical decision making. What we've learned in the lab is that it's not about the exact accuracy of the measure. It's about having a lot of data and comparing that data to itself over time. And so actually it doesn't matter if you get your exact temperature. What matters is having some level of precision in the measurements from day to day, and then you can make a lot of insights. And so I believe that AI will allow the data that you thought was trash to be the data that saves your life.
Next we have, so I want to make a general comment about what RL said, just to bring this home. I mean, I just can't keep myself from saying it. I was in graduate school, I don't know, 40 years ago, and I would run an experiment and I might get 200 data points. 200. I could look at the data in an Excel sheet and tell what worked, what didn't work, where were the trends, and what to do next. My son is in graduate school at UC San Diego. He just graduated in a bioinformatics. I asked him how many data points he gets from one experiment, and he just laughed. He said, I don't even know, millions? And so in some ways AI has technology has moved so fast in terms of what people can do in the lab, what kinds of things they can measure. They can measure the pH in mitochondria, right? Which is a tiny little thing inside a tiny little cell, inside one of your organs in your very big body. And so if you can measure that over and over and over again in a system like that, you have to have something like artificial intelligence to help you make sense of the data. It's simply too complicated. You can't see the trends. The data sets are so large. So next we'll go to Dr. Lena Nader. Lena is the Vice President of Product at Elsevier, leading Elsevier's assessment portfolio. Prior to Elsevier, Dr. Nader was an Associate Dean of Innovation and Assessment, so not new to education, at the University of UC San Diego School of Medicine, where she led the development and implementation of strategies to support the education mission. Dr. Lander has previously worked with Apple Inc. as a development executive, leading multiple technology implementation initiatives to improve education, patient care, and outreach. Dr. Lander has a Doctor of Science degree from Harvard University and an MBA from Wharton.
Thank you so much. And as a true academic, I have a few slides to share. Well, we at Elsevier integrated AI in a number of products, and I wanted to share a couple of examples of how AI can help students teach, learn their content, but more importantly, prepare for that clinical practice, which is what we're talking about today. This is an example of Shadow Health, where students can have conversations with simulated patients and practice those skills, including empathy, which is very important in clinical care. And practicing in non-threatening environment allows them to better prepare to enter that clinical practice space. There is also a complementary VR product where they can practice same scenarios in a more immersive environment. And we're starting to work with Apple on using Apple Vision Pro. We recently announced, earlier this year, we announced a product called SharePath AI, where students can have conversations with their textbooks. So we talked about going to the library and Googling content. The next iteration of that is you can have a chat-like conversation with your content. And what's very exciting about this, it's not the entire internet where students could go to ChatGPT or another type of tool and see the entirety of the internet. We use what is called a retrieval augmented generation, or RAG, where we have a walled garden approach. So this is a very non-technical diagram, but I just wanted to give you an example. So the tools search only with using Elsevier content, and it's textbooks authored by our esteemed authors. All of them are clinicians. So pre-approved content, and students can have a chat-like conversation about that content. And they can ask for clarification, they can ask for questions to quiz themselves. But what I really like about that approach is we know that students are getting the right answers. In nursing and health education, getting the wrong answers could potentially have detrimental effects on patient care. So we work very hard to make sure we're giving students the right content that aligns with curriculum and helps them prepare for practice. We also monitor answers for bias and toxicity to make sure we're not perpetuating bias in healthcare education. So here are some additional examples. And in the spirit of self-disclosure, we have a table at the hub where you can try the product and get more information. But one of the other unique things about SharePath AI, in the answer, so when students submit a query and they get an answer, we also provide videos. So these are osmosis for nursing videos, so that student not only sees the snippet of text, but can see video for additional content, including sources where that content came from. So I'll skip this example, but I'll share later. And I wanted to touch on our responsible AI principles. This is very important and it's core to what we do. So we consider real-world impact of our solutions on people. We take actions to prevent creation and reinforcement of unfair bias. We explain how our solutions work. We know exactly where that content is coming from, and we feel confident in our answers. We create accountability through human oversight, and we respect privacy and champion robust data governance. And I'll end with a quick story. So we look at chat logs from students, and one student kept asking a question on content. And at the end of the session, she typed, "I love you," to chat, to SharePath AI. So that just shows you, when was the last time students said, "I love you" to a textbook? That just shows you the impact of these tools on our students as they go through curriculum and ultimately better prepares them for clinical practice. Thank you.
Next, we have our very own community college faculty, Dr. Jenna Zeller. She's the Assistant Director of Nursing at Cabrillo College. Jenna has over 16 years of experience as a registered nurse and 10 years in nursing education. Since joining Cabrillo College in 2020, she's focused on promoting active and equitable learning in the classroom. Dr. Zeller is particularly passionate about using immersive technology, such as virtual reality sound, to build confident and competent nursing students. And you can tell when you talk to her about students, and she uses these words all the time. The students are engaged and they're more successful when they're using these kinds of products. She holds a BSN from Johns Hopkins University and MSN from the University of Maryland and a PhD from Regis College. Dr.
Thanks, Nanette. So most of my experience related to this has been with bringing the immersive technology into our classrooms. So using the products in a way that are really going to benefit our students in an era of necessary program growth with workforce shortages, a lack of qualified faculty that are willing to take this on, and unfortunately the budget constraints that I think most of us are fighting at this point. So more students, less faculty, do more. And so I brought immersive tech in, and I was like, hey, this will solve all of our problems. And everybody laughed at me. But here we are today. And so what I discovered is that we know we need simulation for our healthcare workers, right? Nobody wants to be the first patient in anything, right? Our students go to clinical rotations, which post-COVID, we don't have enough of. But take more patients, take more students, but we don't have clinical rotations. And I can't control what experiences they will see within the hospital. So I have no guarantee to meet their firsts with me instead of with you as their patient. So I need the simulations to do that for me. So I need to provide a safe way for these students to do it. But anyone who's been involved in simulations, like high fidelity simulations, knows that the faculty to student ratio is not sustainable. The ratios are, for our program, 1 to 6, 1 to 10 max, with only 1 to 2 students actively engaged at a time. And so while there's ways to make that work, with program growth, again, every time I bring in 10 students, I need to hire another faculty member. And we're looking at this, and with virtual reality incorporated with AI, what we have discovered is that we can send students off to play these games. They call it, my students are like, I just want to go play the video game. And they go and they do these virtual reality simulations where I am making sure that the content they need is getting to them. We have AI in the background functioning as the patient with the correct, and just like we were saying, not all of the internet and ChatGPT, but we build those constraints. So it's functioning in a way that it's getting the correct patient symptoms, the correct patient responses to whatever the student's actions are. It's creating a transcript at the end for me as the faculty member to review. So I can have students we've used our gymnasium, for example, and I've got them blocked off in a safe manner with 6, 8 running at a time. They're each talking to their headsets with their own speakers, running through the same scenario, but they're all hands-on at this point. I have students observing at the same time. I've doubled my ratios, and then we all debrief together because I am reviewing all of their transcripts. They can do this at home. So when we have students out sick, COVID lockdown, or just to create a higher volume of students, we can have them work on these scenarios at home. I get the feedback, I get the results, and bring it back. And so we really found that we're hitting more students at one time with the same number of faculty and not increasing our workloads. Because I think that that's the biggest point. And so for me, that's just been the most exciting part of kind of bringing this tech in, is that if we do it responsibly, we can find a way to keep workloads the same. I don't want to say decrease workloads, but shift workloads and really serve more students and ensure that our communities and the healthcare that we provide is high quality, not risking our patients with those first high-risk scenarios.
Yeah. So I'm going to change this a little bit, panelists. Sorry, just hold on. If there's anyone in the audience, you should think about if you have any specific questions. So I have plenty of questions for the panelists, but as we go forward, if you have questions, just raise your hand, and I'm happy to let you come forward with your own questions. Okay, I just want to make that clear. So Jenna, I'm going to start. Okay. Start with you. So talk a little bit about how you are. When we talked about this layering technology in the classroom, I thought that was really interesting the way you described that.
Yeah, that was my next point.
Okay.
Perfect. I put 3 things and I was like, I have to hit today. And that was number 2. So layering. We know that we can't teach our healthcare workforce everything they need to know in the 1-2 year programs that they're coming to us in. So we need to hit it at a layered approach, repeating information and not throwing everything at them. So in most nursing programs, and I imagine other healthcare programs as well, we send them to theory, to lecture class. There's a skills lab where they practice their skills, and dump them into these high-risk, low-frequency scenarios. And anyone that has students doing it, they know that their students talk about the anxiety, the fear. They're being watched by their faculty members and their fellow students. Regardless of how safe we make it, we try to make it, it's not graded, we're here all together, they're still coming in super anxious. So we looked at our curriculum. We said, okay, they're gonna get the theory, then they're gonna go to skills lab and they're gonna practice. And then they're gonna come to virtual reality. And what's really cool about virtual reality is that the IV always goes in the vein, regardless of what happens, and the child can't wiggle out of their arms. So we took away the stress of the skill. So instead I gave them the scenario and I said, what would you do with the patient that's having a heart attack? What do you want to do? My favorite one is the patient is half out of the bed, oxygen is thrown on the floor, urine everywhere, every nurse is like every day, and they walk in and they go, oh my God, I don't know what to do. But there's no one dying. And there's nothing, no skill that they have to feel pressure about. So the IV ripped out. Okay, well you know you're gonna get it. Pick up the IV and place it on the arm and it goes in and there. So we removed the stress of the skill. We do just the clinical competence, the clinical judgment, the critical thinking. Can you work through, in a safe environment, what to do? Then we take them to high fidelity. So now we've added in the same or similar scenario, but the skill as well. And what the students are telling me is that they love it. And we've started surveying students. Their anxiety levels are lower. They're walking out of there feeling more confident because they're finally getting it right. Because we all know high fidelity, there's a lot of what would you do differently next time conversations. And now we're talking about everything you did right because you got to practice it in VR and then come to high fidelity. So they are feeling more successful. Their anxiety levels are lower by really not replacing anything, but adding it in as another step to really building their confidence so that when they see it in real life, the memory is not, oh my God, I failed that, but instead, I do know what to do, and I can do this, which is really what we want. We want strong, confident nurses, not, oh my God, the last time I saw that, I panicked. That feeling of that.
Thank you. Yeah, that's amazing. I love the way you explained it, because for people who aren't faculty or who aren't teachers, if you ever have an opportunity to go into one of these skills labs, you should do it, because it's really amazing what you do for students. It's just...
You can come visit me in February anytime.
Okay, I think I'm going to jump now to Art. Can you describe for the audience what personalized medicine means, and describe how AI will enable more accurate, efficient, and tailored healthcare solutions?
Yes. Personalized medicine is identifying the right treatment for the right person at the right time. And one question to ask around that is, where do we get the numbers that we believe to be ground truth in healthcare? So, for example, temperature. Where did we come up with the idea that 98.6 is a normal, healthy temperature? Recently, I was at the doctor and my temperature was 98.3, and I mentioned that that was high for me. I go to the doctor at Stanford, and my Stanford nurse laughed at me. And so I'm just curious, because where did we get that number? We got it from a study of German men in the 1850s. And we now know that that number is actually not the average, and more importantly, it's not each of our own average. But we believe it to be true so much that we're using it in every single clinic around the world. And my nurse at Stanford is actually laughing at me because she believes that number is a real number. And that doesn't only apply to temperature, it applies to actually every single number at the doctor. So in terms of how do we make healthcare more accurate, efficient, and tailored, we've had now 3 major breakthroughs that enable AI to be applied in healthcare. So number 1, we can measure giant amounts of data. Number 2, we can store giant amounts of data. And then number 3, now that we have advanced analytics and AI, the data that we thought was, again, junk data can actually be analyzed to understand how each person has their own personal baseline, and we can detect things much, much earlier.
Thank you, Arna. UC Berkeley's College of Computing, Data Science, and Society. After talking to you, I know that there was real intentionality in including the word society in the title of the college. Can you talk about why this has been such an important concept to incorporate into the college?
Absolutely. Grounding our new College of Computing, Data Science, and Society with the underscore, double underscore, bold on society was absolutely very intentional, much like Ariel mentioned, getting the right information to the right folks at the right time. My background in electrical engineering, all three of my original degrees, and I know we have a number of degrees across this channel. I do have other interests, I promise. It actually ended up being very multidisciplinary, and so it set this tone for work that I did in Washington, D.C. with the Obama administration, leading the White House Innovation for Disaster Response and Recovery Initiative, which was very much about empowering first responders and survivors with information and resources to make informed decisions and to improve outcomes. And so whether we're talking about health, climate, education, or whatnot, I think there's just this enormous opportunity when you don't put the students and the innovators in a box. I think a very concrete example is our computational precision health program that is joint with UC San Francisco and UC Berkeley, and it's just so rewarding to talk to researchers, faculty, students who thought that they had to choose between computing and data and AI and that sort of bubble of opportunity, or having clinical relevance and working with patients and being in the depths of medicine and health. And this joint program allows them to do both and to allow one to inform the other and to make the ecosystem all the much better for it. So no matter the application, we feel extremely strongly, our founding leadership team, that society has to be centered, equity and the implications and opportunities and challenges around that have to be there in our name.
Yeah, I love that. That's really amazing. And I was really inspired. I mean, I just wanted to stand up and applaud what Dr. Chase was talking about. She's such a motivator. I mean, her background too is amazing. So, Dr. Landry, as many of you know, our community colleges educate a multitude of California's healthcare professions, from nursing, respiratory care, imaging, occupations in oral health, paramedics, medical assistants, and so many, many, many more. How do you see AI transforming the education of healthcare workforce in community colleges and higher education over the next few years?
Thank you for that. And I really want to applaud all of you here for doing this work and learning these tools so we can integrate them into our teaching to ultimately prepare students for practice. I think what inspired me today is all the new things coming up, and we need to prepare students to work in the climate where they'll be using tools we're not even aware of today, whether it's personalized medicine, whether it's high fidelity simulation, or whatever that next thing is. And the only way we can prepare is to integrate them into our teaching now to ultimately help them get ready for clinical practice. Tools like our tools, SurePath AI, Shadow Health, and others have already started down that path. And providing those tools to everyone, their school purchase, provided to students, is the only way to ensure we can prepare students to enter that clinical workforce. So I applaud all of you for being here and learning about these tools. And the only way to prepare students for the next step is to integrate them into teaching today.
So would that be your answer to how institutions ensure that AI tools are accessible and equitable, to make sure that they're sort of system-wide?
They should be system-wide and they should be provided to all students. Otherwise, we'll have this bias between the haves and have-nots, which we very much want to avoid. But the other important point, which I mentioned earlier, is the responsible AI principles. We can't just throw students, go figure it out. We need to prepare them to work with these technologies and to provide that safe environment where we as educators are confident that they are getting the right answers. And we as educators and administrators have visibility into what they're asking so that we can adjust curriculum as they go through the program. So I guess to summarize, it's to provide the tools and start now to prepare them for clinical practice.
So, yeah, I was just going to stop and say, does the audience have any questions? Yes.
Yeah, so,
Do you want the microphone? Yeah. You're facing this way, so just make sure everyone can hear.
so, my name is Dr. Jean, and I'm the president of Montana Community College. And one of the things that we're focusing on is around healthcare awareness. And the goal of AI and what the future of the workforce needs to look like, especially in healthcare. So I get the learning aspects currently that we're utilizing, but what does the workforce need to have for the jobs of the future that are coming, especially around personalized decision making? And what are the skill sets that we need to be teaching now so that the students that are graduating are going to be able to learn those skills later on? Because to your point, you don't have them for 2 years. And so they have to be prepared to be able to continue to learn, and what are we needing to do at this point in time to set up that trajectory, those systems, so that our students are prepared for that on-their-own learning that's so incredibly critical right now.
Thank you for the question. For what school did you say you were?
Dr. Kane,
Got it. Oh, okay, so, right. Anybody want to say that? Meredith, that sounds like a question or no?
I'm happy to. I'm trying to briefly.
And definitely want to hear from the folks who are doing this day in and day out. I think, and this goes to the ingredient question, so we'll take time on that. One of the key ingredients in thinking about the art of learning, as Chancellor Lindbergh mentioned, there's no replacement for critical thinking, right? So still understanding the context. At Berkeley, we integrate human context and ethics into the data science program and find it really crucial to build those connections with other fields. The future is becoming very interdisciplinary and multidisciplinary in terms of how to prepare students to be able to chart their own pathways and to have a sense of agency moving forward. And so I think that is a key ingredient. And I would put a plug in for creative problem solving, teamwork, being able to build fluency with other backgrounds and perspectives to really bring in a diversity of experience and expertise to solve the really hard problems of our future. Someone who does this day in and day out.
Okay. I think for me, who's partially still in the classroom, we have to model it for our students. We have to get them comfortable with the technology by bringing it into the classroom. And one thing that I really found to be beneficial in creating flexible healthcare workers, because really we know that we need them to be pivoting left and right at all times, whether it's the new technology or the patient conditions, or what's the greatest now, is that I bring it into my classroom. And it's not always that I can bring the latest and greatest into the classroom because I don't have access. What I do have is the ability to bring in different modes of teaching and different technology resources, removing kind of that old sage on the stage, not being in front of a PowerPoint, but instead bringing the technology into my classroom, throwing it at them, and saying, let's work through it and figure it out together. So that they're used to clicking buttons, figuring it out, working through these problems in our safe environment. So we bring charting into our classrooms, into our simulations. We bring different game-based learning that they may or may not have had instruction on yet. But be creating that, being comfortable with the uncomfortable, I think creates the foundation for coming into healthcare and new technology being brought in, and you have your rep there, you learn it. But then what, right? All the troubleshooting, all the working with it, all the patient questions where you're like, I didn't see that one coming. Bring it to the classroom first, and really setting that example within my own classroom and then supporting the other faculty within our divisions to bring it in. Whether or not it's the same exact technology that they'll see out there, I don't think it matters as much as getting them comfortable with technology, with AI. We use AI in our classroom all the time. I will tell them, I Google things, just this morning I'm Googling things and getting AI responses, right? I tell them to Google it. Because I know that our nurses are going behind the nurses station and Googling things. So let's Google it and figure out what's correct and what's incorrect, and I'll tell the difference now. And so rather than avoiding it, bringing it all in, I think is really how we're gonna create that workforce that can handle it when real patient lives are on the line as well.
Can I make Lena definitely go now, I just want to make a note. We have to do professional training for our faculty first. The students will model the faculty, and so we really have a lot of work to do with professional development of our faculty. And those of you who have a nursing program on your campus, the Chancellor's Office is doing a series of statewide webinars in immersive technology to prepare your nursing programs to write extremely competitive grants for the $60 million Rebuilding Nursing Infrastructure Grant. We're partnering with Apple to do in-person workshops across the state. So if you're on a campus with a nursing program, your nursing faculty are going to have incredible resources shown to them through statewide webinars, and there is going to be a lot of money available through that Rebuilding Nursing Infrastructure Grant for professional development. And that's really a key point, a key area that we have to address before we can help our students be effective. So,
I also wanted to add that it's only technology because it's new. We don't think of electricity as technology. So we have to incorporate these tools in similar ways when it becomes part of curriculum, when it's integrated into your classrooms, into your lectures, and becomes standard way of doing things. It no longer becomes scary or new. It'll become part of the clinical care. One of our tools is having those chat conversations with medical journals. So preparing students to work in a clinical environment where AI is just normal way of doing your clinical work will help them adjust and continue learning.
anyone, yes, please. Let me give you the mic.
Hi, my question is about, hi everyone, my name is Dr. Heidi Weber. I am the academic dean that oversees the nursing program at Cabrillo College.
Oh, super.
Yes, and Jenna Zeller is our superstar, and we're so proud of her for doing this type of work. And my question is about our students at Cabrillo, and a lot of the ones that all the other colleges will experience would be first-generation students. In our area, we have migrant workers, farm workers, and, if you will, the adult reentry student. I'm thinking about these two groups of people who have not grown up with technology in their homes, and they see this and they're probably scared. Just like when laptops came out, or iPhones and those things, certain groups of people were very afraid of it and didn't think they would know how to use it. And so for our students who are facing that sort of challenge, what sorts of techniques or philosophy or safety nets are you thinking about putting in place for those types of students?
Yes.
I don't want to monopolize this. I think Heidi's my dean, so I know what students, we're at the same students. We have a lot of first-gen migrant workers. So, I mean, they walk in and they're like, download an app. I have a flip phone. And so it really, I think, one, you have to have the resources to provide to your students. I am extremely passionate about not adding student fees or costs to my students unless I'm getting enough value out of it, like per hour. I will break it down per hour. Is this worth it? Or how is it going to be supplied? So we work really hard with grant funding. Our program we have a lot of financial constraints. We work really hard with grant funding. So what Annette spoke about with that grant, I think anyone with a nursing program really should get a hold with. So we can provide the access to everyone without increasing student fees. The other thing is that I've learned you have to have a really good network of whoever your computer support is for your students, whether it's your IT or your CTC. You have to have a great support system within them and have them on board with supporting your students. So if you're going to something as simple as online textbooks. It starts with making sure that student access is there, whether your recs are coming in and training your students or your computer support centers are, because you only layer up from there. I think most of us are using online textbooks at this point. But it only gets harder from there, and so having really the network around the student. We also have right in our program 2 people, plus myself, who are just well known to students that during office hours, they can come in and ask me about their personal tablet. Right, like I have shown them that I am here during my office hours for whatever reason, because helping you with your personal tablet isn't really about helping you with your personal tablet, right? It's about your success in our program. And so really making sure that before you bring it in, that any check in, that you have a plethora of people to support the students, and looking at student costs. I don't believe in adding to our student costs. We really at this point are looking at, if we're going to add, where are we going to go with the student cost? Even in the world of inflation, because my migrant workers are they're barely surviving as it is. So really, the grant funding, as we're going to keep going for.
Yeah, no, absolutely. I want to add, thank you, Sharon. I want to add one final comment. And I don't want to put you on the spot, you Apple lady. I do want to tell you that I think one of the things when you talk about sort of level setting is that when the students come in, they all need to have access to the same technology. All of them. And it can't just be for the students who can pay for it. It really has to be to everyone. And so, we have a college at Riverside Nursing School, who just on accident partnered with Apple to get iPads for all of their students just before the pandemic hit. And that program didn't miss a beat during the pandemic because all the students had access to technology that allowed them to work away from the classroom and still communicate and learn from their faculty. And we're going to take this information and lift up what Riverside has done in collaboration with Apple and their educational support people to 3 different locations across the state. All of your nursing programs will be invited to attend. I'm just going to give you a chance to say hi.
Hi, my name is Sylvia Herrero, and as Nanette said, I am with Apple. I think to just bounce off of what Jenna and Lena said and to Heidi's question, it is imperative that we not only work with faculty to enhance teaching and learning, but digital literacy is a real thing, and we've got to work with the students, and that has to be part of the plan and the program. If you talk to any CNO in a hospital, they do not want to be teaching your students how to be digital literate. They want you to have those students already coming into their program with the knowledge of how to use technology. And it's pervasive in the hospital, and in clinics, and in the healthcare realm. And so that's probably one of the key components that we've seen with any student equity program is please not only think about faculty and in professional development for faculty, but incorporate digital literacy into the students' tracks at the beginning of the program. If the student understands how to use it, they are going to flourish in the academic year. And that's just, and create cohorts of students helping each other and create a community of practice for students as well. And that's one of the best practices we've seen. And we're going to be sharing a lot of those best practices at the events that we host in Riverside, in Sacramento, and at Apple when we do the day event for the Bay Area.
Thank you. Thanks so much. So we are at the time that we are supposed to wrap up. Thank you. Thank you for coming. If any of you have nursing programs and you'd like to talk to me about what is happening, what's coming for your schools, I'm more than happy. I'm already connected to your nursing program directors, but I see some CTE people here, so if you'd like to reach out, I'm happy to connect. And thank you to our